Good morning, everyone. My name is Adedapo Osinowo. I'm the medical consultant to Niola Cancer Care Foundation. I'm a general surgeon with Lagos University Teaching Hospital and a senior lecturer with College of Medicine, University of Lagos. The title of my presentation today is Colorectal Cancer in the Young, the experience of my tertiary institution in Lagos University Teaching Hospital. The incidence of colorectal cancer in the young is increasing worldwide, and this has also been noted in Nigeria. This is particularly worrisome as the diagnosis is usually made when the disease is advanced. Colorectal cancer is the fourth commonest malignancy in Nigeria, and the peak age of colorectal cancer from a review carried out in my institution 20 years ago was the sixth decade of life, that is between the ages of 51 and 60. The young is defined as any patient below or equal to 40 years of age with a diagnosis of colorectal cancer. In this review done in my institution, we had 71 cases of colorectal cancer in the last 2 years, out of which 23 cases were in the young, that is 32.4% of the cases. The review further revealed an age range of between 17 and 40 and a mean of 25.5 years. The male-female ratio was 1.8 to 1. There were 16 cases of colon cancer and 7 cases of rectal cancer. All colon cancer cases presented with abdominal pain with a mean duration of 7 months, while the rectal cancer cases all had intermittent bleeding with a mean duration of 10 months. 2 patients with colon cancer had undergone appendectomy on account of abdominal pain before being referred to our institution. All patients had standard evaluation with computerized tomography scan of the abdomen and colonoscopy. Rectal cancer patients were further evaluated with MRI of the pelvis to locally stage the disease. As regards modes of presentation, 10 cases presented as emergencies on account of intestinal obstruction, and 1 patient with rectal cancer presented with massive rectal bleeding. 21 patients underwent surgery, while 2 cases of rectal cancer had initial neoadjuvant chemoradiation and chemotherapy. The operations done were 15 colectomies, 2 abdominoperineal resections with permanent colostomies, 3 colostomies, and 1 patient had unresectable tumor at exploratory laparotomy. 2 patients died in the postoperative period, while 2 other patients died after adjuvant chemotherapy. 21 patients had stage 3 disease, that is 91.3% of the cases, and 3 patients had stage 4 disease, that is 8.6% of the cases. There were no cases of stage 1 or stage 2 disease. The incidence of colorectal cancer in the young is increasing in Nigeria, and diagnosis is usually made when the disease is advanced.
Hello, fellow advocates in the colorectal cancer community. I am Eniola Omoro Akintunde, the Executive Director of Niola Cancer Care Foundation, the first colorectal cancer NGO in West Africa. I'm glad to be part of this virtual conference on global patient advocacy, a cause for action, organized by our partner, the Global Colon Cancer Association of Philadelphia. It is a good development despite the global pandemic and challenge that we were able to put this together, and we are glad we are part of this. We are part of this to share our experience and to share our experience on colorectal cancer in Nigeria, and I'm speaking on early onset on colorectal cancer in young adults in Nigeria. I'm going to speak from the human angle, that I'm going to speak from my experience with my late husband, who I lost at the age of 39 to colorectal cancer. And in that process, I learned a lot of lessons from his treatment till when he passed on. And what I learned in India, that was outside. One of those things was information dissemination. In India, where I was being carried along on what is happening to my husband when he had lack of potassium, when he had water retention, they were telling me everything. But in my country, our doctors here don't really review a lot to caregiver or to the patient, and it's due to our belief as a country. We have some traditions that restrict our doctors from coming out. Like Nigeria, we don't talk about death. So how can a doctor be telling a patient that you are going to die? Like what I experienced in India, that they were telling me he has 3 more weeks to live, he has 2 more weeks to live, he has a few seconds more to live. In other Western worlds and developed country who manages cancer, this is not a new thing. I'm very sure that, but it is very strange to our own culture in Nigeria and as in Africa. You don't tell patients, especially in Nigeria, you don't tell the caregiver or you tell the patient that the patient is going to die. So me getting to India and they were telling me that my husband is going to die, it sounds so very strange. It's very strange, and I was about losing it, as in I always lost my mind. Like, can you be telling me that my husband will soon die? He has few more seconds, and truly, when it was few more seconds for him to go, he left. Okay, he died, and there are some lessons I learned in that process. Those are the things that prompted me to there's a vacuum that needs to be filled. Because after he died, in my pain, I thought of how do I give back to my country. That was how I set up Niola Cancer Care Foundation. Because while he had that cancer, when he had the cancer and where he was on treatment, there was no NGO on colorectal cancer in Nigeria that I could talk to, that I could speak to, that could understand my pain, my challenges, how to manage my husband, apart from his doctors, his oncology doctors. So those are the things that prompted us setting up Niola Cancer Care Foundation. And so far, so good. We'll be able to push the message, create awareness on colorectal cancer. What are the factors linked to early onset of colorectal cancer in Nigeria? We discovered that environmental factors, which is also a global thing, global warming and all that. Environmental factor is part of the causes that has been linked to increase in colorectal cancer in young adults in Nigeria. Our lifestyle, the young adult lifestyles, you see most of them on social media, they're on television, they don't move about, they don't do exercise, lack of exercise, that's a healthy lifestyle. Then also another challenges we also have that has been linked to is screening, accessibility to screen. Most of us does not have, an average Nigerian cannot afford to go for screening because it's not accessible, it's not cheap. It's not cheap at all. We all know that screening for colorectal cancer globally is expensive, including in Nigeria. And we are talking about a country that the poverty rate is a bit high, and so the challenges are there. So an average Nigerian cannot afford screening, but we still encourage them to still go. And to still go for their checkup, and then to imbibe the culture of healthy living and eating right. We have so many organic food in Nigeria, so we encourage people to eat organic food. So these are some of the things. Then access to screening, we are still talking to the government. We are part of the policy making now. We are seeing what we can do to encourage early screening, early detection. So factor linked to increase of early onset of colorectal cancer in young adults in Nigeria. We've discovered that environmental factor, lifestyle, access to screening, these are some of the challenges that the research that we've seen that leads to increase in early onset of colorectal cancer in our young adults. The environmental factors, pollution, air pollution, and toxin. Then the lifestyle, that's sedimentary lifestyle, eating habits, lack of exercise, and all that. Those are the causes of this. These also are causes of colorectal cancer. And then screening is not accessible. An average Nigerian cannot afford the screening for colorectal cancer. We as an NGO, that is where we come in, and because we encourage them that the earlier we advocate for and encourage early detection, which saves lives. The earlier it is detected, the better. And most cases, if colorectal cancer is picked early, it is still localized, there's 90% of survival. So these are some of the challenges that has been linked to colorectal cancer, increase in colorectal cancer in Nigeria. That's access to. Average Nigerian does not have access, cannot afford the screening process. Like we partner with other laboratories, registered laboratories, to carry out screening. What we still use, we still do fecal occult blood tests. That is what we use as an NGO to screen. Then further investigation, if it comes out positive, then we refer them to any of the tertiary health institution for further investigation and screening. And also we've been able to screen over 1,000 Nigerians we started in 2017 to 2018, then 2019. So we'll be able to screen over 1,000 individuals for FOBT, and so far so good. We've encouraged people to be conscious of their health and what they eat, and that's their overall well-being. Then also, these are part of the things that Niola Cancer Care Foundation has been able to do in the short space of time that we started in 2016. We'll be able to influence policies, government policies' role in the area of providing facilities, access to good health care, advocacy for colorectal cancer management and control in Nigeria. As we said, there's still minimal awareness on colorectal cancer in Nigeria. Most Nigerians don't want to listen, and they don't want to hear about you talk about cancer, including colorectal cancer, because there is a myth on that cancer is a disease and it's a spiritual attack. They believe that the cancer is sent, that is either through wizard or witches that send cancer to you. So it's a spiritual battle. It's not something of the physical. So whenever you talk about cancer, they will say it's not my portion. And we always ask, as an NGO, we ask them that whose portion is cancer. Like my own husband was a Christian and he had cancer. So cancer does not respect anybody, does not respect religion. So we just have to do what we need to do. We need to be conscious of what we eat. We need to be conscious of taking care of ourselves. We need to be conscious to start encouraging screening. These are the things that other developed countries are doing. And our government need to make health care accessible to its citizens. So these are the things we have been doing as an NGO. And the myth, we've been telling Nigerians that cancer is nobody's portion. Cancer is nobody's portion. Nobody prayed for cancer. So then to also get their attention, my country, Nigeria, we are very happy people. We love party, we love dancing. So as an NGO, we sat down, how can we get the attention of Nigerians to listen to us, to hear us out, to hear the message and encourage them on screening and creating awareness. So we sat down and we started this, we set up a program called Ijoya. Ijoya has been on, we've been able to do three consecutive years. We were able to, last year was the third event of Ijoya. We'll be doing Ijoya annual event, whereby the upper year we're able to gather over 2,000 participants. Last year maybe 1,000 because the weather was not really favorable. And the response has been very, very amazing. At that event, people will be dancing, aerobic exercise. Then we display organic food, Nigerian produce. Then we bring in medical experts and doctors to come and speak on colorectal cancer. We'll be doing that annually. It is called Ijoya. Ijoya means in Yoruba, in Africa, dance. Let's come and dance. So you see people moving their body, people dancing while we are communicating the message on colorectal cancer. And then there will be music, and then there will be shopping, then there will be screening. So they also do screening at that event. And be able to screen some few people. And if the result is positive, then as we've said, we'll refer them for further investigation. And that has been very, very encouraging on Ijoya. Niola Cancer Care Foundation needs the support from Global Colon Cancer Association in view of the scarce and non-availability of resources in order to spread the information and create more awareness about colorectal cancer in Nigeria and Africa at large. With GCCA collaboration, we can do more in terms of peer health education, because we are talking about the younger people, young adults having colorectal cancer, impacting projects and programs aimed at creating necessary awareness.